Well, the old saying that the eyes are the window to your soul can also be said a different way, that your nails are a window to your health. Although the most common problem with nails are nail fungal and ingrown toenail, other systematic diseases in the body can also contribute to disfiguration sign of symptoms on your nail. So one should not ignore their nail. One should actually see a specialist at the first sign of problems such as ridges, discoloration, thickness, pain, and deformities of the nail to be discussed by your podiatrist to be diagnosed and treated. For example, toenail fungus is generally defined by nail becoming yellowish, brownish, or even black, thickness of the nail. Sometimes they become painful. You can see debris forming underneath the nail. The nail become brittle and hard to cut. One thing to remember is that toenail fungus is an infectious disease. You're not inherited it from your parents or from your sibling or anything. This infectious disease happens as a result of you coming in contact with the disease. Most patients who contract toenail fungus are generally people who have cut fungal infection in their skin at the beginning. So most of the time, untreated athlete's foot can turn into a toenail fungus. Other method of catching a toenail fungus would be directly into the nail through the skin. Most patients have a history of having fungal infection on their skin, which is called athlete's foot. After a while of athlete's foot staying on their skin, it would eventually start migrating into the nail bed and eventually into the nail plate. One thing to remember, it's extremely hard to treat toenail fungus infection. The reason being that the infection is deeply seated within the nail and the nail bed. In order to get rid of it, the variety of options would include topical medication, oral medication, surgical options, and also recently we've been doing laser treatment of toenail fungus infection, which we've been getting great results. My name is Dr. Kourosh Harounian, and I'm a Los Angeles Podiatrist.